There's a news report from the Associated Press entitled, "Iranian Police Use Force to Break Up Protest." Tehran, Iran, riot police attacked hundreds of demonstrators with tear gas and fired live bullets in the air to disperse a rally in central Tehran Monday, carrying out a threat by the country's most powerful security force to crush any further opposition protests over the disputed presidential election. Witnesses said helicopters hovered overhead as about 200 protesters gathered at a square, but hundreds of anti-riot police quickly put an end to the demonstration and prevented any gathering, even small groups, at the scene. Iran says at least 17 protesters have been killed in a week of unrest so far after the Electoral Council declared hardline President Mahmoud Ahmadinejad winner of the June 12th elections. Severe restrictions on reporters have made it almost impossible to independently verify any reports on demonstrations, clashes, and casualties. Iran has ordered reporters for foreign news agencies to stay in their offices, barring them from any reporting on the streets. So the story goes on. Demonstrations followed by repression, followed by murder in the streets. And as these things seem to evolve, an event took place which may be the defining moment just yesterday in the struggle of the Iranian people to be able to peacefully disagree with their government, in this case because of a corrupt and fraudulent election, without being killed in the streets and beaten and imprisoned. And it has to do with a woman named Neda. And I quote from a ABC News story dated June 22nd, 2009. And I quote, "She sinks to the ground and a few minutes later she's dead." A video that has been repeatedly posted on the internet purports to show the last moments of Neda, a young Iranian woman shot in the heart by government sharpshooters. Overnight, she has become a symbol of the opposition. They're shaky, blurred images. A young woman collapses onto the pavement. A dark pool of blood spreads beneath her body. Two men kneel next to the woman and press on her chest, screaming. The camera film, which is filming her, zooms in on her face. Her pupils roll to the side. Blood streams out of her nose and mouth. "Neda, don't be afraid. Neda, stay with me. Neda, stay with me," cries one man. Another man beseeches someone to take her in a car. Then the footage stops. The video footage appeared on the social networking sites Facebook and Twitter on Saturday evening. It immediately became a viral sensation, being forwarded repeatedly. User groups were determined to get around YouTube's attempts to block the immensely graphic film. They posted the clip so often that it became impossible for YouTube to remove it. So, Mr. President, we've seen, as we have in cases of other brutal repression throughout history, the living example or the dying example of martyrdom. And by Sunday morning, Neda became the 5th most commented topic on Twitter. She had already become a kind of Joan of Arc. Quote, "It took only one bullet to kill Neda. It'll take only one Neda to stop Iranian tyranny," was one posting from Tehran on Twitter. Quote, "Neda died with open eyes. Shame on us who live with closed eyes. They killed Neda, but not her voice was another." During the day, thousands of people replaced their profile pictures with tributes to the young woman, such as "I am Neda" or "Neda forever." Others posted images of a broken heart in green, the color of the opposition movement. So, Mr. President, a debate has been going on as to how much the United States of America, its President, the Congress, and the American people should speak out in favor and in support of these brave Iranians. Average age in Tehran is 33 years of age, in their quest for the fundamentals of freedom and democracy that we have enjoyed for more than a couple of centuries. So, Mr. President, today I and all America pays tribute to a brave young woman who was trying to exercise her fundamental human rights and was killed on the streets of Tehran. All Americans are with her, in our thoughts and our prayers for her, her family, and her countrymen. Now, Mr. President, I'd like to talk a bit about health care, since that seems to be a major issue, also of concern to all Americans. Today is June 22nd, 2009. Millions of Americans still lack health insurance coverage, and we need to pass reforms that help them get coverage. Yet more time has gone by with no plan from the majority. While we wait, how many more people will forego needed care today? How many emergency rooms will have to care for Americans who could have received care earlier and at a lower cost from a medical professional if they had insurance? Mr. President, the majority talks about reform and how critical it is to move with urgency. They also assert that the economic recovery depends on health care reform. So many of us would like to know, where is the plan? It's impossible for us to move forward in any manner, let alone with urgency, if we don't even have a complete bill. On Tuesday, June 9th, after months of waiting, the majority in the Health Committee, on which I serve, offered a partial list of health reform proposals, indicating that the missing pieces would be shortly forthcoming. The majority quickly pulled together a roundtable to discuss a wide variety of issues. They even held some walkthroughs with our side on issues of prevention, quality, etc. The following week, we were told we would receive the missing pieces soon, or early last week. Then we were told they'd come forth with the missing pieces this past Friday, and now it's Monday, and we have received nothing. While we've waited, the Congressional Budget Office told us what many of us had expected and feared about this bill. The cost of the bill would have us a cost exponentially higher than many had predicted. In fact, the incomplete bill would cost over $1 trillion, but this cost would only cover 1/3 of the 48 million Americans who are currently uninsured. So we wait and wait and wait, having no details of the much-vaunted government plan or the proposal regarding penalties the other side wants to impose on employers who either can't provide health coverage, who aren't able to provide the coverage according to the government dictate. Now we hear that this Friday might be the day we have a chance to see what they've been working on behind closed doors. Friday also happens to be the day of the 4th of July recess. The President and congressional Democrats have told the American people that health care reform legislation must be passed by the Senate prior to the August recess. Given that we won't have the text of the legislation prior to the 4th of July recess, I'm skeptical that the Health Committee and the Finance Committee will be able to complete their work, combine two possibly divergent bills on the Senate floor, and pass a bill during the 5 weeks remaining in the July work session. And one thing I have found out around here, Mr. President, is that we miss a lot of things, but we never miss a recess. The Senate passed the budget blueprint in late April. That included a possible budget reconciliation process for considering health care reform legislation. One must wonder if the majority is intentionally pushing back the schedule and dragging out this process so that a bipartisan process and solution is not feasible. Under budget reconciliation, it sounds arcane to most Americans, the majority would be allowed to jam this important policy through the Senate with 51 votes instead of the typical 60, with a limited time for debate and amendments. I am left to wonder if this contingency wasn't planned on all along, to use reconciliation to muscle through the health reform that we all know is desperately needed, but to circumvent the normal procedures of the United States Senate. So, I and my colleagues on this side of the aisle continue to await the Democrats' complete bill and their plan to make taxpayers pay for this trillion-dollar new government program. So many questions remain until the missing parts of the bill are provided. When will we get details of the government insurance plan we are told is essential to reform? When will we see what employer health care mandates look like? How much will the complete plan cost? How will it be paid for? Each day, the majority fails to provide a complete plan, along with the complete cost and how it will be paid for, is another day that millions of Americans go without health insurance. Mr. President, I ask unanimous consent to have the two news articles that I quoted and my complete statement as part of the record.
Without objection.
Mr. President, I suggest the absence of a quorum.